Hello, I am Dr. Jaya Jain, consultant physician practicing as a diabetologist in Dilshad Garden. Today, the topic of my discussion will be diabetes related complications, and how diabetes is directly and indirectly responsible for various heart disease. And what can we do to understand this and prevent this? So, first of all, briefly talking about diabetes. Diabetes is a metabolic disorder in which the blood sugar levels usually go up because the body is not able to metabolize the blood sugar due to insulin deficiency, relative and absolute, or due to ineffective insulin, or we can say insulin resistance. Because of this high blood sugar persistent for a prolonged period of time, the complications set in. These complications may range from involve usually from head to toe, including the eyes, where we see diabetic retinopathy, kidneys, nephropathy, nerves, neuropathy. It involves the blood vessels as well, and it involves major organs like brain and heart, causing heart disease as well. Diabetic patients are more prone, twice as much as risk for heart disease and stroke compared to their non-diabetic peers. So the relevance of controlling diabetes or blood sugar is here right now. Now, what about heart disease? Heart disease usually is a major complication of diabetes, and one of the major reasons for admission and mortality in a diabetic patient. So we need to manage the diabetes to manage the heart disease. Now, what exactly is heart disease, which we are talking about? We are talking about coronary artery disease, in which the blood vessels of the heart, they get blocked, clogged to some extent or to large extent, cutting the blood supply to the heart muscles, leading to myocardial damage and eventually the complications set in. Now, how is diabetes responsible for this? So, we'll just briefly try to understand what exactly diabetes does, which leads to various heart related complications. So, when the sugar is left uncontrolled for prolonged period of time, and diabetes is associated with other complications like high blood pressure, high cholesterol, all this leads to endothelial damage, means damage inside the blood vessels. And when the heart vessels, means coronary artery diseases, coronary arteries, they get damaged and their endothelial dysfunction sets in, these cholesterol, high cholesterol or bad cholesterol, along with platelets, form atheromas which stick to the blood vessels, narrowing the caliber of the arteries. If this artery occlusion is complete, it leads to myocardial infarction, or we call it heart attack. So there is a major need to eliminate all these things. Now, how does diabetes happen? Normally, when we eat something, the blood sugar level goes up. The body produces insulin, which helps in metabolizing this sugar, letting this sugar go inside the blood cells, which later use it for energy generation. Now, if there is insulin deficiency, relative or absolute, or resistance, this sugar level is not utilized, leading to very high titers of these blood sugar levels, causing complications. Now, how can we prevent this? Now, this is the most important part of this topic. Prevention is more in the hand of the patient, less in the hands of the doctor, because both should go hand in hand. As the doctor advises, we should be taking our medicines, we should be taking our insulin. Whatever treatment has been advised should be adhered to properly. But the patient also should play a major part in the management of diabetes. And this compliance to a diet, compliance to physical activity, de-stressing, not adhering to bad habits has to be taken by the patient itself. So the patient should be taking the medicines in time, the patient should be monitoring the sugar regularly, the patient should be sticking to a very good diet plan along with physical activity. And in case if the sugar is not controlled, then he should be consulting the treating physician in case if any of this happens. Now, how can we manage this? So, first of all, we should understand the ABC of diabetes. A is HbA1c. HbA1c is the average sugar of the last 3 months. It's a good tool to monitor grossly how the sugar has been doing for the last 3 months. It is not like a fasting 2-RPP which we monitor at home daily, but it gives us a very good idea about how your sugar control is going. Target should be keeping between 6 to 7, but we do individualize the HbA1c targets as well. In younger patients, we keep a stricter target. Second, B is blood pressure. Blood pressure is most often associated with diabetes, and the complications are seen far more severe in diabetic patients who have associated blood pressure as well. So we should manage the blood pressure very strictly, maintaining it to less than 140/80. In case if not, then the titers of the antihypertensives needs to be modulated by the treating physician. C is for cholesterol. Cholesterol needs to be kept in check very strictly. LDL cholesterol should be preferred to be less than 100, because we, as already I just briefed up earlier, LDL cholesterol is directly responsible for causing atheromas in the blood vessels. HDL cholesterol is a good cholesterol which helps in preventing cardiac problems. Now, apart from the ABCs that we are talking about, we also talk about diet, which plays a major important role in blood sugar control. So when we talk about diet, it's not just cutting down on carbohydrates. We need to cut down on fats as well. We need to improve our protein and the fiber content in the diet. So cutting down on carbohydrates and fats may be in the form of, shifting from saturated fats like vanaspati to unsaturated fats like refined oil, using more of, mustard oil, corn oil, soya bean, sunflower oil. That is preferable. We should switch from high fat milk or full cream milk to low fat milk. We should also try to take off, fat from the meat or the non-vegetarian sources that we are taking. Try not to use processed foods. We should also avoid using refined flour like maida. Cut down on low fiber stuff. Try to increase more of fiber in our diet, taking lots of green leafy vegetables, lots of salads, and lots of fruits in our diet. So that will increase the fiber content of the food, and that will benefit at a later date. Also, sugar containing drinks like soft drinks, fruit drinks should be preferably avoided, because these bring the sugar up. Proteins and whole cereals should be preferred compared to these, in the sense that pulses in all forms, nuts, flax seeds, and cereals in toto should be encouraged and used more often. Apart from this, salt content should be kept to the minimum. So as I said, packaged foods should be kept to the minimum. Added salt should be avoided. Salt sprinklers that we keep in the table should be kept away. High salty foods should be kept to the minimum. It will aggravate or increase the blood pressure. Apart from this, de-stressing plays a major role in management of diabetes, because stress levels definitely increase our blood sugar levels. So how to manage the stress? Everyone have their own ways of managing their stress, but alternative treatments like meditation, yoga, pranayam, deep breathing exercises needs to be followed by each and every diabetic, right? Sleep has to be adequate. At least 6 to 8 hours of quality and quantity of sleep is needed properly. Apart from this, habits like smoking and alcohol should be cut off completely. Cessation markedly improves hypoglycemic and hyperglycemic episodes and prevents in diabetic complications from happening to a large extent. Apart from this, we should try to encourage physical activity. Diabetic patients should be indulging in more and more aerobic activities, which may be in the form of simple walking or cycling or jogging, maybe swimming, any form of exercise which they are capable of doing. This physical activity should be started for short duration with less intensity, and then once the patient gets adjusted to it, the duration should also be increased and the intensity should also be increased. I personally advise all my diabetic patients to walk at least 8,000 to 10,000 steps in a day, provided their physical condition permits them. So it's a holistic approach. Patients should try all these things, try to manage the blood sugar level to the advised range with all these measures. Stick to the good, healthy dietary plan. They should not be starving themselves. Stick to a very good physical activity regimen. Monitor their sugar. Consult the doctors if there are fluctuations. With all these things, all these lifestyle modifications, diabetes can be managed very well, and patient can lead a very healthy lifestyle. Thank you. Thanks.